She's 67 and she has abdominal pain and hematochezia. So lots of bright red blood per rectum. So does everyone see the finding? It's not subtle, but it's tempting to always want to call this colonic wall thickening as some sort of infectious or inflammatory colitis. But this colonic wall thickening is pretty extensive, and I suppose is not associated with as much pericolonic stranding. So any thoughts?
Can you show us the vessels?
They're here. So they're all patent, but she's also a vasculopath. She has hypertension and high cholesterol, and as you can see, she's obese. So suggested that this could be ischemic colitis, and they basically went on to do this colonoscopy, and it showed some diffusely erythematous and friable colon with ulcerations. And this to them is pretty consistent with ischemic colitis, and that's also what the pathology shows. So mucosa changes consistent with ischemia, some surface withering, attenuated epithelium, lamina-appropriate fibrosis. Kind of a classic case of ischemic colitis, and it's nice when we were able to suggest this, although we also don't want to overcall it. But usually seen in greater than 60-year-olds and usually from low flow states. We're always looking for the occlusion in the artery, but commonly from low flow states. And the descending colon and splenic flexure are the most common areas. Usually you see segmental colonic wall thickening as opposed to diffuse. All right, so that's the first case. And